From MTN News, this is Montana This Morning.
A jury in Butte says guilty in the trial of a man accused of helping his son kill a Broadwater County Sheriff's deputy. The scene from inside the courtroom from last night coming up. Plus, learn how many schools are turning to COVID tests in an attempt to keep students safe and classrooms open as the pandemic continues. We are just ahead of 6:30 on this Wednesday. Shelly and Matt Elwell with you here. That's a beautiful shot taken from our camera high atop Montana State University right now.
Beautiful. I don't know that you got a chance to look at the sunset yesterday. It was phenomenal. I didn't have.
I missed it. Yeah, no,
I was driving, so I couldn't grab my camera and do all that stuff. But
I completely missed it.
It was fabulous, and I think today we're looking at a very similar situation with a little bit of cloud cover moving in. Temperatures right now into the low to mid 30s for most of us. 23 out toward West Yellowstone. It looks like our planner calling for daytime highs into the 70s. It is going to be a pleasant afternoon. We'll talk more about what you can expect as you head toward the weekend. Warmer weekend ahead. We'll talk about it in just a few minutes.
All right, thank you, Matt. 6:30 now. Our top story. A Butte jury says the man accused of helping his son kill Broadwater County Sheriff's Deputy Mason Moore back in 2017 is guilty. MTN's Caitlin Aguilas has our story.
On the charge of count 1, deliberate homicide by accountability, we, the jury, find the defendant guilty. On the charge of count 2, attempted deliberate homicide by accountability, we, the jury, find the defendant guilty. On charge count 3, attempted deliberate homicide by accountability, we, the jury, find the defendant guilty.
The jury listened to the closing arguments of the state and defense before they deliberated on a verdict in the trial of Lloyd Barris. Barris is accused of aiding his son Marshall in the May 16, 2017 shooting death of Broadwater deputy Mason Moore. Prosecutors reiterated that Barris and his son were men who shared anti-government feelings and had purposely instigated the deputy into a pursuit on Highway 287. During the pursuit, Marshall shot at the officer and killed him near Three Forks.
This case is an evil partnership between Lloyd Barris and his son Marshall Barris to satisfy their desire, to satisfy their hatred of the government and law enforcement.
After the shooting, Lloyd Barris is accused of leading police on a wild pursuit across the state that ended in a gun battle with law enforcement in Missoula County. Lloyd surrendered to police and Marshall was shot and later died in the shootout. The state rested its case on the 8th day of the trial after calling numerous law enforcement and expert witnesses to the stand to testify. Defense attorney Craig Shannon also rested his case that day without calling a single witness to testify on behalf of the defense. The defense closed by arguing that Barris had no intention to kill the officer.
It's their job to tell you the truth, and I'm just pointing out where they didn't. I told you in jury selection that your job is to find reasonable doubt.
In Butte, Caitlin Aguilas, MTN News.
6:32 now, and other headlines this morning. One man is dead and his half-brother still missing from a backcountry trip to Shoshone Lake in Yellowstone National Park. Search and rescue crews found the body of Mark O'Neill, a canoe and some gear along the east shore of the lake on Monday morning. The two were reported overdue by a family member on Sunday. Now, crews on foot, boat, and air continue to look for Kim Crumbo. Both of the men are retired National Park Service employees, and Crumbo, a former Navy SEAL. Shoshone is the park's second largest lake. It's at the head of the Lewis River, south of West Thumb. Park officials say the lake's average year-round water temperature, 48 degrees. Survival time in that cold water estimated to be only 20 to 30 minutes. Also, Montana National Guard members are being deployed to hospitals across the state to help in the COVID-19 fight. Governor Greg Gianforte says all current and former requests for 6 hospitals will be fulfilled to help the doctors and nurses on the front lines. Montana hospitals say staff workers severely strained with the latest surge of the virus. 70 men and women of the Guard will be going this weekend and next weekend and will help with non-medical ICU assistance, environmental services, patient data entry, and COVID testing. Bozeman Health will get the requested 10 people. St. James Healthcare in Butte will be getting the requested 6. Helena, Billings, and Missoula hospitals will also get Guard members. Governor says 10 National Guardsmen began assisting Billings Clinic last Wednesday. 7 National Guardsmen also began assisting the state lab last week. State says it anticipates more requests from several other hospitals. And new COVID-19 cases continue to climb in the state, with the latest report showing 1,181 more people infected. We're close to 10,000 active cases in the state of Montana right now, 131 new cases in Gallatin County, and of those, about 39 are among younger people. Those patients range from 0 to 19 years old. 14 more deaths have been added statewide and makes 1,901 people who have passed away. Flathead County has the most new cases, followed by Missoula, Yellowstone, and Gallatin. There are 28 new cases in Silverboe County. Yellowstone County continues to have the most active cases. And due to the pandemic, Gallatin County Rest Home now under quarantine. A staff member tested positive for COVID-19. The quarantine will go until October 5th unless there's another positive case, which will add days. Administrator Darcel Vaughn says all staff will be tested every day before every shift, no matter their vaccination status. All residents were tested on Tuesday. Residents are required to be tested every 3 to 7 days for the next 14 days. Those tests will be more frequent for any residents who show signs or symptoms of an infection. 97% of the residents are vaccinated. As another safety precaution, all in-person visits are now canceled. You can still call, set up Zoom meeting, or have a window visit. Compassionate care visits are allowed, but only for residents who have had a major decline in their health. Also, Butte Silverboe Health Officer Karen Sullivan retiring. It will be effective November 19th. The Board of Health Chair Ivy Fredrickson and Butte Silverboe Chief Executive J.P. Gallagher both congratulated and thanked her for her incredible leadership during the most trying of times. Sullivan has been health director for 8 years. She said it's been the honor of her lifetime, and in her words, quote, "This work has been challenging and invigorating, but with COVID-19 event, it has also become very fatiguing. First off, I intend to rest." Now, the Board of Health and county officials met Monday afternoon to talk about a search for Sullivan's replacement. Pandemic is endangering children right now at an alarming rate. More than 925,000 of them have tested positive for coronavirus since mid-August. Some schools have been forced to close, and as CBS's Nancy Chen reports, others are taking a new approach.
A COVID vaccine for kids as young as 5 could be weeks away, and a shot for younger children could come soon after, according to Pfizer's Senior Vice President, Dr. Bill Gruber.
We have studies now ongoing in 2 to 4-year-old children, as well as 6 months to 2-year-old children.
But in parts of the country, vaccination rates for eligible kids remain low. Just 42% of U.S. children ages 12 to 15 are fully vaccinated, and more than 2,000 schools in 39 states have stopped in-person instruction due to outbreaks. To keep students in class, school districts are changing tactics. In New York City, Mayor Bill de Blasio announced the city would begin randomly testing unvaccinated consenting students every week instead of every 2 weeks.
When there is a positive test, the unvaccinated students in the classroom will not have to quarantine if they are masked and 3 feet distanced.
But the teachers union president is calling those rules ill-considered, adding that the ability to keep kids 3 feet apart and masked is a fantasy.
The mayor did an amazing thing.
Still, Daniela Gimpel, whose 3- and 7-year-olds are currently enrolled in city schools, says she's encouraged by the city's new approach, one that's closer to the CDC's guidelines.
What does a policy like this do for people's lives?
It was very difficult last year. I feel that they used testing to shut schools down. And I'm hoping that this year they use testing to keep them open, to show that schools are safe and to keep school going through the whole year.
Nancy Chen, CBS News, New York.
Now, here's what we know about Pfizer's COVID vaccine for younger children in the United States. The vaccine administered the same, 2 doses, 21 days apart, but the dose itself is 1/3 smaller than the dose for adults. It's routine to adjust dosage in vaccines and medications for younger children.
The data look very solid, they look effective, and they look safe.
Now, Pfizer says in its initial trials, the vaccine was safe, well tolerated, and sparked robust antibody responses. It said side effects were generally comparable to those observed in participants 16 to 25 years old. Nearly 2,300 younger children received the vaccines in the trials. There was no shortage of volunteers.
And of course, the children are volunteered by their parents, and the parents tend to be better educated. They're often medical professionals I volunteered my children for influenza trials, for example. And there are many other parents who just wanted their child to have a chance at getting vaccinated.
Now, the data comes a little earlier than expected, and it has not been peer-reviewed yet. Next, it will be shared with an FDA panel for a review that could take 4 to 6 weeks. That review may lead to emergency use authorization consideration. That would make the vaccine possibly available around Halloween. There's urgency to get more kids vaccinated, with children accounting right now for nearly 1/3 of all virus cases reported in the U.S.
Because increasingly, our children's hospitals are seeing admissions of completely normal, healthy children laid low by COVID in a very serious way. We'd like to prevent, obviously, as much of that as possible.
Now, vaccine data from Moderna on this age group will also likely be coming soon, meaning we could have 2 vaccines for all school-age children soon. Data on children younger than 5 will come out later this winter. In other news, we're getting toward the end of our Give a Child a Book campaign, and we're asking you to help us put us over the top. You can join MTN staff members who've already donated to this cause to help us buy books to give to local elementary school kids. This year's books will go to West Elementary in Butte and Saddle Peak Elementary in Belgrade. Our parent company, Scripps, matches all donations. Southwest Montana Honda dealers, Denny Menholt in Bozeman and Lescavar Honda in Butte donated $5,000. There is a link on our website where you can make a donation. We'd appreciate it very much. Time to take a quick break here on Montana This Morning. When we come back, taking a look at the effects of using your phones as a possible diagnosis for depression. We'll take a look at that when Montana This Morning continues. But first, here's Tony DeCopel with a look at what's coming up on CBS Mornings.
Good morning. Ahead on CBS Mornings, the agonizing new decision some women are taking because of the restrictive abortion law in Texas. We'll introduce you to some who've been forced to travel hundreds of miles out of sheer desperation. We'll tell you where they're going as well. Also, the FBI has handled some of the most notorious crimes in U.S. history. Only on CBS Mornings, get a rare look at the treasure trove of evidence and artifacts hidden away in the FBI's headquarters. And finally, Drew Barrymore will discuss season 2 of her Emmy-nominated talk show and what it's like at last working with a live audience. All that and more at 7.